You went to bed last night feeling completely fine. No chest pain, no dizziness, no warning signs. And yet, while you were asleep, your brain may have been experiencing a restricted oxygen flow. Not because of a disease, not because of a medication, but because of the exact position your head was resting in when you closed your eyes. We need you to hear this carefully, because what we are about to share has nothing to do with diet, nothing to do with exercise, and your doctor has probably never once brought it up during any of your checkups. Over years of reviewing cardiovascular and neurological research for patients in their 60s, 70s, and beyond, one silent pattern keeps emerging that almost nobody in mainstream medicine talks about openly. The way you sleep, the angle of your neck, the direction your body faces, the position of your spine is actively influencing how well blood reaches your brain every single night. And here is the part that stops most people cold. Stroke risk peaks in the morning hours after waking, with a 49% increase between 6 a.m. and noon, driven by the morning blood pressure surge. That is not a coincidence. And what happens during the hours before that window, how you sleep, what position you are in, whether your body is properly recovering overnight, directly determines how vulnerable your cardiovascular system is when that surge hits. So before you dismiss this and say, I have slept this way my whole life, stay with us, because in the next few minutes, we are going to walk you through 6 sleeping mistakes ranked from surprisingly harmful to genuinely dangerous. And then, we are going to give you 2 evidence-backed positions that could be doing your brain and your heart a real favor in starting tonight. If you are new here, welcome to Health is Golden, where we cover the health information that actually matters, explained clearly and without the jargon. Hit subscribe and turn on the notification bell right now so you never miss a video. And before we go any further, drop a comment below and tell us, are you a back sleeper, a side sleeper, or a stomach sleeper? We will be referencing all 3 throughout this video, and your answer is going to matter very soon. Understanding why sleep position changes everything. After 60, before we get into the list, understanding the why is going to make everything else make sense. When you are young, in your 20s and 30s, your blood vessels are elastic. 8, they stretch. They adapt, they compensate. Even if you sleep in an awkward position, your cardiovascular system quietly corrects for it. You wake up with a stiff neck, and that is usually the end of it. But here is what changes after 60. Your arterial walls begin to stiffen. The small vessels feeding your brain become less flexible. The pressure inside your skull becomes more sensitive to changes in body position. And your blood pressure regulation system, the one that keeps everything balanced, becomes slower to respond, especially at night. Doctors call this overnight blood pressure dipping. Healthy sleepers experience a natural 10 to 20% drop in blood pressure during sleep. This is protective. This is your body recovering. But if your sleep position is wrong, if it is compressing the wrong vessels, restricting the wrong airways, or tilting your blood flow in the wrong direction, the natural protective dip gets disrupted. And what fills that gap is something far less friendly. That is a framework to carry into everything that follows. Mistake number 1, sleeping fully flat without any head elevation. Let us start with something that sounds so benign it is almost hard to believe it could cause a problem. Sleeping completely flat. No pillow or just a thin one. Body perfectly horizontal. Spine supposedly aligned. It sounds ideal, right? Physiotherapy websites praise it. Mattress companies build their marketing around it. But there is a critical piece of the picture that nobody is showing you. When you lie completely flat, and particularly after age 60, like blood does not distribute evenly the way it does in a younger body. In the absence of gravity working in your favor, cerebrospinal fluid, the fluid that cushions your brain inside your skull, can pool. Intracranial pressure edges upward. The tiny vessels in your brain that are already dealing with years of mild wear are now under slightly more pressure than they should be for 7 to 8 hours straight. A study published in the Journal of Clinical Sleep Medicine found that even modest head elevation, as little as 15 degrees, led to measurable improvements in intracranial pressure and nighttime blood flow dynamics. Now, here is the symptom most people completely misread. You wake up at 3 a.m. with a dull, throbbing headache. Maybe behind your eyes, maybe at the base of your skull. You think, I'm getting older, headaches happen. You drink a glass of water, maybe take an ibuprofen, wipes, and go back to sleep. But what if that headache is your brain's way of saying the pressure in here has been too high for hours? The fix is not complicated. A 15-degree elevation of your upper body. We will show you exactly how to achieve that safely toward the end of this video. Have you ever woken up with a headache you could not explain? Drop a comment below and tell us every single one get red, and you might be describing something more people are experiencing than you realize. Mistake number 2, stomach sleeping, the position that twists everything. This one surprises almost everyone because stomach sleeping feels like it should be harmless. You are not putting weight on your heart. You are not compressing your lungs. It is just lying face down. What is the big deal? The big deal is your neck. When you sleep on your stomach, you physically cannot breathe with your face straight into the mattress. So you rotate your head to one side, typically the same side, every single night because we are creatures of habit. Your neck is rotated up to 90 degrees for 7, 8, sometimes 9 hours per night. Running along the sides of your cervical spine are 2 arteries called the vertebral arteries. These vessels carry blood directly to your brainstem, your cerebellum, and the regions of your brain responsible for balance, breathing regulation, and coordination. When your neck is rotated significantly to one side for prolonged periods, these arteries can become kinked. Think of it like stepping on a garden hose. The flow does not stop completely, but it becomes restricted, and restricted flow to your brainstem for 8 hours, night after night, year after year. Docs, is not something your body simply shrugs off. Research published in the Journal of Manipulative and Physiological Therapeutics confirmed that extreme cervical rotation measurably reduces vertebral artery blood flow velocity. There is also a second problem with stomach sleeping that affects breathing. Your rib cage is pressed against the mattress. Every breath you take all night is a breath fighting against compression. Your diaphragm cannot fully descend. You never reach full tidal volume, the deepest, most restorative breath your lungs are capable of. Lower oxygen per breath, restricted artery, both happening simultaneously. For a 35-year-old, the body compensates. For a 68-year-old with any degree of hypertension or cardiovascular history, this is a cumulative problem building silently in the dark. Mistake number 3, stacking multiple pillows under your head. We want to stay in the neck region for a moment because the next mistake is one that people do with the best of intentions, and it creates a very similar problem through a completely different mechanism. Stacking pillows, 2, 3, sometimes 4 of them all under your head. People do this for real reasons: acid reflux, sinus drainage, breathing difficulties, snoring, and a small amount of elevation does help with some of these issues. But here is what happens when that elevation becomes excessive. Your head gets pushed forward significantly, your chin tilts toward your chest, and that forward bend of the neck, what clinicians call cervical flexion, compresses the very same vertebral arteries we just discussed, but this time from the front. There is also a third vessel that gets overlooked in this conversation, the internal jugular vein. This vein is your brain's primary drainage pathway. It carries deoxygenated blood back down from your brain toward your heart. When your neck is bent forward excessively, the jugular drainage pathway becomes partially obstructed. Blood drains less efficiently, pressure inside the skull builds slowly, and the brain's ability to clear metabolic waste overnight becomes compromised. You might notice this the next morning as brain fog, a heaviness behind the eyes, or that frustrating feeling of waking up from 8 hours of sleep and still not feeling rested. You are not lazy. Your brain may have literally been under pressure all night. The correction is simple: one pillow, and one properly contoured pillow. Ideally, a memory foam cervical pillow that supports the natural curve of your neck rather than forcing your head into an angle. Many people have reported their morning headaches disappeared within a week of making this single change. We are halfway through this list, and if this is already making you rethink how you sleep, hit the like button right now. It costs you nothing, and it genuinely helps this reach more people who are waking up tired and do not know why. And tell us in the comments, how many pillows are you currently using at night? 1, 2, or more. We are genuinely curious. Mistake number 4, right side sleeping with a cardiovascular history. Now, we are getting into territory that is going to surprise a lot of you, because side sleeping in general is considered one of the better positions. And for most people, it is, but the direction you face matters more than most people realize. Your heart sits slightly left of center in your chest. It has a natural orientation. When you lie on your right side, gravity pulls your heart slightly away from its optimal resting position. More importantly, your body weight compresses the right side of your torso, and the inferior vena cava, one of the body's largest veins, runs directly through that region. The inferior vena cava has one job: return blood from everything below your waist, your legs, your abdomen, your digestive organs, back up to your heart. When you compress that vein by lying on the right side, the return flow becomes restricted. Your heart has to work against reduced preload, meaning it is pulling harder than it should just to fill each chamber properly. Psychs, for a healthy person, this is compensated for easily. But for someone over 60 managing borderline heart function, mild heart failure, or chronic high blood pressure, your heart is already running close to its ceiling. Adding unnecessary nightly resistance is like running your car engine 10% harder every single night for years. The cumulative wear is real. The European Journal of Heart Failure published findings that patients with heart failure naturally and instinctively avoided right-sided sleeping. Their bodies had detected the discomfort before their minds consciously identified why. That instinct is worth listening to. If you commented that you are a right-side sleeper earlier, this one was written for you. Keep watching because the solution at the end addresses this directly. Mistake number 5. Sleeping in a tightly curled fetal position. Knees pulled up, shoulders rounded inward, chin tucked toward the chest. For many people, especially women over 60, this is the default go-to. It feels warm. It feels protected, like the body is wrapping itself in a hug. And emotionally, the appeal is completely understandable. But physiologically, 3 things go wrong simultaneously. First, your lungs are compressed. The rib cage cannot fully expand. Every breath is shallower than your body needs. Blood oxygen saturation dips incrementally with every breath across a full night's sleep. Second, the blood vessels running through your hip joints and knees, particularly the popliteal vessels behind the knee, get bent and partially compressed. Circulation to and from the lower limbs is reduced. If you already have a tendency towards swollen ankles or poor leg circulation, this position makes both worse. Third, your neck is flexed. We have already talked about what that does to vertebral artery flow and jugular drainage. All of the same concerns apply here, just through a whole body version of the same compression pattern. Research in respiratory physiology and neurobiology documented that sustained spinal flexion during sleep measurably reduces tidal volume. The amount of air inhaled per breath. Multiply even a 10% reduction across every breath in an 8-hour night, and you are talking about significantly less oxygen delivered to already aging brain tissue. If this is you, the adjustment does not have to be dramatic. A body pillow between your knees and a slight opening of the hip angle. Small changes, real improvements. Owalkshire mistake number 6, late eating and alcohol. Close to bedtime. This is the one that brings together everything we have discussed and amplifies it, and it is the most socially common mistake on this entire list. You finish dinner at 7:30, maybe a glass of wine while watching television. Bed by 10. That sounds like a perfectly normal evening for millions of adults over 60. Here is what is happening inside you while you sleep after that scenario. After a large meal, your body reroutes blood to the digestive system. Significant blood volume is redirected away from your brain and heart toward your gut. In younger bodies, this redistribution is seamlessly managed. In older bodies with less arterial elasticity and slower autonomic nervous system response, this shift can create transient drops in cerebral blood flow, moments where the brain is subtly undersupplied. Now add alcohol. Alcohol is a vasodilator, and it relaxes and widens blood vessels, causing your blood pressure to drop. Your body senses this and compensates by constricting vessels and raising pressure again. Blood pressure yo-yos up, down, throughout the night. And in vessels that are already dealing with some degree of plaque, stiffness, or age-related fragility, that oscillation causes real stress on arterial walls. The American Journal of Hypertension studied this exact pattern and found that even moderate alcohol consumption within 3 hours of sleep disrupted the natural nighttime blood pressure dip that healthy sleepers experience. Without that dip, overnight cardiovascular strain increases meaningfully. You may know what this looks like. You wake up at 2 a.m., heart hammering, sweating slightly. You think it was a vivid dream, but what you experience may have been your vascular system trying to stabilize itself through a wave of pressure, fluctuation it was not equipped to handle gracefully. The recommendation? Finish eating at least 3 hours before bed. If you drink alcohol, stop 4 to 5 hours before you sleep. Take a 15-minute gentle walk after dinner. Not exercise, just movement. That simple act begins digestion, normalizes blood sugar, and gives your cardiovascular system a chance to settle before you go horizontal. Be honest with us in the comments. Are you guilty of any of the mistakes on this list? Just drop a number. How many of the 6 are you currently doing? We genuinely want to know. And share this video right now with someone over 60 in your life who keeps waking up with unexplained headaches or that unrefreshed feeling every morning, you might be giving them the answer they have been looking for. The two positions. Your brain actually wants position. 1. Left side sleeping. This is without question the most evidence-supported sleep position for cardiovascular and neurological health in adults over 60. When you sleep on your left side, gravity works in alignment with your heart's natural orientation. The inferior vena cava, the vein we discussed, runs on the right side of your spine. Left side sleeping takes compression off that vein entirely, allowing blood to return to the heart from the lower body freely and efficiently. Your heart works less. Circulation stabilizes. But here is the discovery that truly changed how sleep researchers think about position. Scientists identified a system called the glymphatic system. Think of it as the brain's overnight janitorial crew. While you sleep, cerebrospinal fluid pulses through the spaces between your brain cells, flushing out metabolic waste products, including amyloid beta and tau proteins, the same proteins found in excessive quantities in the brains of Alzheimer's patients. A landmark study published in the Journal of Neuroscience found that this glymphatic clearance is most efficient when you sleep on your side. And the left side appears to offer slightly better drainage geometry due to the brain's natural asymmetry and the direction of cerebrospinal fluid flow. This means left side sleeping is not just about tonight's circulation. It is about whether your brain is adequately clearing the waste products that, over decades, accumulate into cognitive decline. If you have never been a side sleeper, use a full-length body pillow to support your front. It prevents you from rolling. Put a pillow between your knees to keep your spine neutral. Give it 7 days. Your body will adapt faster than you expect. Position 2, back sleeping with 15-degree elevation. For those who truly cannot tolerate side sleeping, joint pain, shoulder arthritis, or simply decades of back sleeping habit and intuitus, there is a safe, effective alternative. Elevating your upper body between 15 and 30 degrees. Not just stacking pillows under your head, the entire upper torso needs to be elevated on a gradual incline. A wedge pillow works well. An adjustable bed frame works even better. What does this achieve? It uses gravity to assist blood return from your lower body. It reduces the pooling effect on intracranial pressure that flat back sleeping creates. It keeps your airway more open, which improves oxygen delivery throughout the night. And if you add a small pillow under your knees to maintain the natural lumbar curve, you achieve what sleep researchers call a zero gravity posture, where pressure is distributed across your entire body evenly, minimizing strain on any single vessel or joint. This position is particularly beneficial if you experience mild sleep apnea, frequent morning headaches, swollen legs, or have been told your blood pressure remains high even while asleep. Your sleep environment matters. Position alone is not the complete picture. Your sleep environment shapes whether your cardiovascular system recovers or labors through the night. Temperature. Keep your bedroom between 65 and 68 degrees Fahrenheit. A cooler environment helps your core temperature drop, the trigger for deep restorative sleep. It also naturally lowers nighttime blood pressure. Too warm and your heart rate stays elevated, keeping you in shallow sleep stages where no meaningful cardiovascular recovery happens. Light and screens. Blue light from phones and tablets after 9 p.m. suppresses melatonin production and delays your entry into deep sleep. Your brain's glymphatic system, the waste clearance mechanism we discussed, operates most actively in deep sleep. Disrupt that and the clearing stops. Put the phone away. Read something physical instead. Noise. Sounds that do not wake you fully still interrupt deep sleep through brief, invisible micro-arousals. Your heart rate spikes. Cortisol rises. These events do not register consciously, but your vascular system notices every single one. A white noise machine or earplugs can eliminate this variable entirely. One monitoring tool worth considering, an overnight pulse oximeter, a small clip-on device that tracks your blood oxygen throughout the night. If your oxygen regularly drops below 92%, that is a conversation you need to have with your doctor. It could point to sleep apnea, circulation issues, or early respiratory problems, all of which significantly increase stroke risk. This is data your physician will actually want to see. Here's what we need you to take away from this video. Your risk of stroke does not clock out when you fall asleep. In many ways, the hours between midnight and dawn are the most critical hours in your cardiovascular day. And the position your body is in during those hours is something you have direct, immediate, zero-cost control over. Pick one thing from today, just one. Switch to your left side tonight. Elevate your head 15 degrees. Stop eating within 3 hours of bed. Trade 3 stacked pillows for 1 contoured one. Any single one of these is not a small thing. It is a consistent nightly intervention that compounds over weeks, months, and years. Here is what we need you to do right now. 3 things. 1, drop a comment below and tell us which change are you going to make first. Reading your answers genuinely helps us understand what you are dealing with, and it might help someone else in this community recognize a pattern they have been ignoring for years. 2, share this video on Facebook and tag someone over 60 in your life, a spouse, a parent, a sibling who keeps waking up with unexplained headaches or that unrefreshed feeling every morning. You might be giving them the answer they have been searching for. The share button is right there. Use it. 3, subscribe to Health is Golden and turn on your notifications right now. Next time we are covering the 5 early morning symptoms that cardiologists say are far more serious than most people recognize. Symptoms that appear in the first 20 minutes after you wake up, that are often dismissed as just aging, but that may actually be your body sending a very specific warning. You will want to catch that one. This is Health is Golden. Sleep smart, protect your brain, and take care of yourself.